watching us from. This is another episode of informed teaching on reproductive health and fertility issues. This is your fertility doctor. I am Professor Alexander Tisdewolabi, a reproductive health specialist of over 30 years of experience and head at the Department of Obstetrics and Gynecology where you live. Today we are looking at the issue of male factor infertility. You may be trying to get pregnant for months or for years. And most of the time, the first question that comes to the mouth of most people is that, what is wrong with that woman? And is that the right question to ask? Is that the particular information that is needed? But most of the time, that is what most people will say, what is wrong with the woman? Not knowing that it is not only the woman that is involved in making a baby. The man also has his own responsibility, and it is a couple affair. And so the question that's supposed to be asked is, what is the problem? And what can we do about this problem? Not that what is wrong with the woman. And so male infertility is real, and it is what you need to do is to evaluate and find out what is the condition. Male infertility it's not just the fact that a man can, have sex, ejaculate, but it involves the man may be healthy. Nothing is wrong with him. His physical exercise is good. His reproductive capacity is good. He can have sex, and he's not sick. There's no form of sickness with him, but the sperm may be inadequate. The sperm may be low, have low sperm count, and may not be able to, impregnate a woman. And so it is very important that our men be evaluated, because the main factor is real. And it is not just the ability to have intercourse with the wife and ejaculate. Okay? Now, when you look at it, what is male factor infertility? Male factor infertility is inability of the husband to impregnate his wife based on the factors based on the fact that some things are wrong with his reproductive function capacity. And that is the need to evaluate. It's very important. And so when this happens, there are various stages in the male factor issues. And when you look at the sperm production, the problem may be in the sperm production aspect. The problem may be in the transport of the sperm to the reproductive organ of the woman. The problem may be hormonal imbalance in the man. The problem also may be that the activity of the sperm is inadequate. And so it is very important that we look at these issues and not just blame the woman. And so when you look at this particular problem, you get the fact that the male factor infertility is real, and we can look at what are the things that can be done to correct it. What are the major causes? And when you look at the causes, number one, we can have problem with sperm production, which is the testicles working to produce the sperm. We have signals coming from the hypothalamus into the testicles because it's hormonally regulated. The sperm cells develop within the testicles, and there's maturity of the sperm cells, and they acquire the ability to move and be motile. As such, then the issue of transport through the vast difference to the prostate, and then during ejaculate, that sperm production is contributed into the fluid produced by the prostate and the seminal vesicles, and this now produces what we call the semen, which is ejaculated into the woman. So any issues around that line can cause a problem. Now, another major cause is varicosity of the testicular veins. Because of the testicular vessels can become congested and form varicose veins. But it is not every case of testicular varicose veins that is responsible for male factor. These need to be assessed by the doctor, the expert in that area, so as to distinguish which one that will need treatment and one that will not need treatment. So then the other aspect is hormonal imbalance. As we said, there are many hormones that are used in the system that, if it's not adequate or is is higher, then that can lead to the poor production of the semen. And part of the hormone that is tested is testosterone, follicular stimulating hormone, luteinizing hormone. These are part of the hormones that are tested. But we discovered that some people may be using testosterone blindly, which is very bad, because except there's a diagnosis, so that testosterone is necessary in by the man, which is diagnosed by the doctor, it is wrong for people to be using testosterone injection, testosterone tablet to try and augment the productivity of sperm, because testosterone, when given when it is not necessary, will suppress the production of the hormones in the hypothalamus, because there's a negative feedback, and that suppression will affect productivity of the sperm in the testicles, and so that will also be a negative factor. Then we have infections. Infection of the reproductive tract in men can be a major factor, and this infection can take place at various periods of the development of the man. Maybe in the early stage of his life, maybe there may be what we call the mosaitis, which can affect the testis, and even infections can be in the prostate. We have prostatitis, and other sexually transmitted infections can affect and jeopardize sperm production. If there's issue of surgical operations in the groin, may also affect the testicular transport system. Now, again, genetic factors in the male can also be a factor in that affect the production of sperm. But this case need a specific evaluation, and of course, the percentage of that is not as common as in as other factors. And again, lifestyle challenges can also affect sperm production. For instance, somebody is smoking. Smoking can affect sperm production, and somebody is on heavy alcohol intake can also affect sperm production. And so all these problems the lifestyle problems can cause reduction in sperm production. And so it is very important that a man be evaluated. Again, when you talk about evaluation of a man, you should not feel embarrassed, and you should not feel that his masculinity is affected. No. The fact that there's a reduction in sperm count, or we have low sperm count, does not mean that that's the end of the road, that the woman may not be able to reproduce. There are some cases where you have low sperm count and natural conception can still take place. But it is good to actually diagnose this problem and know early enough so as to take necessary steps without necessarily delaying evaluation of the man. Again, some people may say, can stress cause it? Let's look at that aspect. Most of the time they say, it is stress that is the problem. Just to relax and it will come naturally. You don't need to worry yourself. That is not medically, that's not a good medical information, because stress can affect the head, sexual intercourse. Stress can affect generally in the body, but that is overemphasizing to say that the stress may be the cause of the infertility without actually examining the man, without evaluating. And so if they now just agree with that and relax, and over time, time is going and the woman is not evaluated, then the other problem can come in with the woman. Then another aspect is that both, whatever may be the challenges, the couple need to be examined together. The couple need to be evaluated together, we should not assume that it is the man that we are suspecting in this case, and we are not even out to blame anybody, because the two sides have to be evaluated. And if the woman is not evaluated, because we have seen cases where the woman may say, it is my husband that has problem. I will tell them that we don't assume that the husband has problem. You need to be evaluated, because once the two of them are evaluated, you have little problem in the man, you have little problem in the woman. Then, by the time you take care of all those aspects, then you can see that solution will come early enough. And so, the main factor is real, and we need to look at it in that way, that yes, the main factor need to be taken care of. Then, are there any sign, in the man? Are there any sign? Because the man look healthy, there may not be any sign whatsoever. No testicular swelling, no pain, no. I am Professor Alexander Tuesday Wolabi, a reproductive health specialist of over 30 years of experience and head at the Department of Obstetrics and Gynecology, where you live. Today, we are looking at the issue of male factor infertility. Again, when most of the time, when couples are trying to achieve pregnancy, and maybe over the months, over the years, that they have not achieved pregnancy, the question that generally comes to the mind of people is, what is wrong with this woman? What is wrong with the woman? Is that the correct question to ask? Is that, no, it is not the correct question to ask, because male factor infertility is also very, very important. The man can be responsible for infertility. In fact, we know that in those days, years before, 30% of infertility is caused by men, 30% by women, and 30% both factors, and 10% unexplained. But we know that recently, the contribution of the men to infertility has increased to about 40 to 50% of the relationship between the two of them. And so it is very important. It's not that because the woman is healthy, now is normal exercise, is doing his normal work, and is not sick, is having adequate sexual intercourse, normal sexual drive. That does not mean that, but the semen may be inadequate, the sperm may be inadequate, to be able to fertilize the woman. So the issue of reproductive male factor infertility is our major topic today, and we want to dive into it to explain all the details, aspect of it, and so that to encourage our men to present early for evaluation, and by such, one can detect the problems and find solution to it. Whatsoever, that does not mean that invariably there may not be some sign, but most of the time, they may not have any sign, there may not be testicular pain, there may not be any swelling of the testicles, but at the same time, if there are pain in the testicles or swelling or any lump, you need to go forward for assessment. So it's very important. And maybe they have had issue of infections in the past, need to be reassessed. Very important. Or any history of surgical intervention. So these are things that need to be assessed. Now, what of the male fertility itself? How do we look at it? Now, because it is an intricate system that takes place before the sperm production is. So when we talk about normal fertility, the sperm production, that sperm that is produced must be normal, and ability to move, motility of that sperm. Then that sperm need to be transported through the transport channels and be released into the system, so that by the time there's intercourse, then the sperm will be deposited in the woman. So it is very important that these are issues that need to be looked at, and that so that the sperm production can be released to be used by the woman during the process of fertilization. Now, the sperm that is also ejaculated to the woman must have the capacity to travel through the reproductive tract of the woman to get into the tube. The tube is responsible for picking the egg in the woman, and then the sperm meets with the egg there, and then there's fertilization. So all these processes are intricate, and are delicate. And it's not just a straightforward issue that this man can have sex, there's nothing wrong with him. No, it's more than that. And so we need to look at it and basically approach it in a standard way that we know that can fully assess and then be used in the to dictate whether there's any issues there, and then we can use that. Now, the semen analysis. What are the components that we look at? Is one of the major things in fertility assessment is that the male factor can be easily assessed, but most of the time there's delay in assessing the male factor, because all the time in most society the woman will be blamed first, whereas the male factor assessment is easy, and it is very important to recognize that. Now, in the semen analysis itself, what it is entails, when the man produces the semen, we allow it to liquefy. After liquefaction, we look at the volume, we measure the volume, and then we look at the semen quality, the number of the sperm concentration within the semen, whether it's adequate or not. Then you look at the morphology, the size and shape of the sperms themselves, and then you look at the motility. Are they progressively moving forward, or are they retarded, or is there any issue with the sperm moving? So these are very critical issues. And so again, the man should not exercise any anxiety when he's asked to do this, because it's part of the way of assessing and evaluating. If you dictate the problem, if the problem can be solved, it will prevent delay in the management of the couple. And so it is very important that semen analysis is done early enough. We have seen cases where the woman has no problem, but the man has not been evaluated over the years. The woman was not evaluated over the years, and then maybe after 5 years, the woman developed fibroid. She had the fibroid operation. The man is not yet assessed. After another 5 years, making 10 years of infertility, the fibroid got to recurrent again, and then the woman has another surgery. Until finally, the man is examined. Discovered that the problem is a case of severe oligospermia in this woman. That is, the sperm is very low in quantity, and the capacity to move was very poor. And this can be solved by in vitro fertilization or intracytoplasmic sperm injection. But because the man was not evaluated early enough, the woman who was even fertile and more fertile at the early stage of her life has now developed fibroid and has had fibroid operation to 2 times. So that is the advantage of early assessment, and it's a couple affair. It's not a blame game. Nobody wants to blame anybody, and nobody should be blamed, because the interaction between the male and the female is very, the factors, the male reproductive system is very important, and so nobody should be blamed. What we want to achieve is to get a diagnosis and to move forward. Now, when we look at this, what are the other tests that can be done? In the case of after semen analysis, of course, we take detailed history of the man. Look at the story. Is there any history of scrotal swelling before? Is there any history of groin surgery? Is there any history of recurrent infection in the man? Has he had any swelling of the testicles? So these are things that can do. Then again, the hormones can be assessed, and scrotal scan can also be done. All this will help to assess the male factor infertility and be able to dictate the problem that is there, and then we'll be able to bring forth solution to it. Now, what are the options for treatment? What are the options for treatment in the case of when we have low sperm count, or there's azoospermia, or there's derailment in one way or the other in the sperm quality? So again, as I said, the woman must also be evaluated along the line. Of course, when you treat the problem of sperm production, you want to look at it. Okay, what are the factors that are militating against the sperm production? Looking at the local system in the testicles. Now, is it a case of some men may be wearing tight briefs, the temperature in the testicle may increase, and you see some cases where you have undescended testicles that can also affect, because the temperature of the testicles is outside the body, so that the temperature can be lower than the body temperature, and that is why it is outside. If the temperature is increased, then sperm production will be affected, and that is why varicosity also is part of what causes temperature to be increased in the testicles. And once the varicosity is assessed, some of them can be operated, and not all of them need operation. Some that need operation can be evaluated by the expert in that area, and then treatment can produce good results. Then, if it is due to a case of hormonal imbalance, because such hormones can be corrected, and if it is issue of genetic problem, then it can be evaluated and managed as such. And there are some cases where there's no sperm at all in the ejaculate, and those are the cases we call azoospermia. When there's no sperm, now that does not mean that the sperm production may not be ongoing. The problem may be what we call obstructive azoospermia. That is, the transport system, has been affected by infection. When the seminal vesicles can be infected by gonococcal infection, it can be blocked. Then again, previous surgery, groin surgery, maybe anorrhaphy, somebody has had a hernia and somebody went to operate, and they have interrupted with the seminal vesicles. There are some cases of voluntary vasectomy in some men for one reason or the other. So such a case, that is iatrogenic, and so if such a thing is happening, there's discontinuation in the transport system. Then the transport system, the vas deferens, may be congenitally absent. If it's congenitally absent, then but the testicle may be normal and producing sperm. The semen is being produced, the sperm are active. Then there are ways that we can use it to fertilize the egg by doing seminal aspiration. So it is very important that we look at that. The male factor can be treated. One other way that we can treat it is through intrauterine insemination. When we have low sperm count, the sperm can be washed and transferred into the woman during the time of ovulation. This is done by the expert in that field, and IUI. Then again, in vitro fertilization can also be used to solve the problem, and especially the use of intracytoplasmic sperm injection, which we call the ICSI treatment. The ICSI treatment has revolutionized male factor management, especially in this environment. In those days, there were no solution like the ICSI in treating male factor infertility. But with the advent of the ICSI, treating male factor infertility, we discovered that many males are coming up now to own up, because there's something that can be offered. Now, in the intracytoplasmic sperm injection, one sperm is taken and injected into one egg at the same time. Because when you have severe low sperm count, the natural selection rate of insemination, natural insemination, is very poor and will not take place. And so, but this ICSI has revolutionized the management, in the sense that under the microscope, one normal sperm is picked and injected into an egg, and then you move it aside, put another normal sperm, inject another egg, and such. Because of the reduced number of sperms when we have low sperm count, penetration of the sperm naturally is affected. And so when you have this ICSI, so this ICSI has helped to revolutionize the management of male factor infertility. And we discovered that with this advent of ICSI, many more men are coming up, to be treated. Now, so that is very important. Now, what is the role of supplements? When we talk about supplements, again, of course, the internet is a lot of advertisement of supplements, of trying to use that to solve. There's no quick magic in this area. There's no quick magic because the supplement use of minerals and all those supplements may not have any relevance in the management of male factor infertility, because not many of them has been satisfied to be useful. But people advertise it. They say, okay, get your sperm, your sperm count increase in 30 days. Take this drug and then your sperm will improve. Those are advertisement gimmicks, and one need to be very careful. So that is why a man need to be evaluated. You need to see an expert, reproductive specialist in this area, to assess the male factor and to look at what is necessary, not just using a blind approach to manage the cases. And supplements has not been so much found to be very, very useful in this area. So, and then it is very important that this kind of information, if you know anybody that needs this information, this informed, evidence-based information about male factor infertility and infertility generally, please share this video with them. Hold attention to it. Let them look at it. Let them know that there's hope for male factor infertility, and a lot of them are treatable. There are some factors that can be corrected, and this, the diagnosis will be made, and then we will not just be assuming that there's no problem. And so it is very important that you share this video with relatives, with people that you know it will benefit them from, and then also like and share it, subscribe to the channel, and so that the next video will come to you and be able to follow all the trend. Again, you can also make comments in the channel. Make comments there. Tell us what other topics you want us to look at. You want to look at the issue of low sperm count. You want us to look at the issue of varicosity of the vein, or what other area, what other challenges in male factor infertility that you want us to look at, and really we'll definitely take it. And so it is very important that we share this video. Thank you very much.